Hello and welcome to the University of Southern Indiana Dental Hygiene and Dental Assisting Oral Radiology Calibration presentation. Guidelines for radiology can be found in both program handbooks. Page numbers are on the slide for each program. A copy of the Dental Hygiene Program Handbook is available for faculty in the huddle room. Students have access to these handbooks in every single Blackboard site. Dexters are mannequins that are utilized to allow students to practice their radiology skills without exposing a live client. Dexter requirements increase for students in number and rigor as they progress through our programs. The Dexters are located in the storage cabinets in Radiology Room 4. The Dexters that are used in our clinic are pictured. The skin is removable, and we are using them without the skins in the radiology laboratory to allow students to better visualize these brand new skills. These skins are difficult to maneuver, so I would like faculty members to encourage students to attempt to take their Dexter radiograph series with the skins attached to best replicate a live client. Faculty can use their judgment and let the student remove the skin for retakes as necessary. With that being said, Dexter series allows students to take retakes and get the perfect set of images rather than just achieving clinically acceptable. This may result in more retakes on a Dexter than a live client. Students must have faculty approval for retakes. Exposing a retake without prior faculty approval will result in an unsuccessful attempt for the series. I do encourage faculty members to assist students with retakes to best allow them to learn the technique, error, and correction. Students are not required to evaluate the Dexters for anatomy, as the Dexters have varying levels of anatomy. I do not want students to choose the Dexter based on if they have to evaluate for anatomy or not. With the Dexter, students are required to evaluate for technique errors. Technique errors are the numbers listed on the radiograph evaluation sheets. To begin the live client radiology assessment, the students must first assess the radiographic history of the client. The radiographic history section of the EcoSoft notes are in the blue box pictured on the slide. Many patients seek care outside of the USI clinic, so it is imperative for students to have a conversation with the patient regarding their radiographic history rather than just solely relying on the patient's USI dental chart for this information. This section of the notes must be complete. Never or unknown are acceptable, but leaving any portion of the radiograph history notes is not. If a patient is unable to give an exact date, but is able to state longer than X number of years, that is acceptable for a student to document in this section. For the clinic radiographic protocol, students should first discuss the importance of radiographs with the patient and advise the patient on the need for radiographs if it is clear. Students are expected to be prepared to discuss their decision with advising faculty at permission to proceed. Students need to discuss what their recommendation would be to faculty, who will then help the student come to a conclusion prior to discussion with the staff dentist. Students will then secure dentist permission and complete a radiographic care plan with patient signature. Radiograph care plans are not to be signed by the patient prior to dentist approval. Dentist approval and a signed radiographic care plan must be completed before any image exposure. Students also need to inform the clinical assistant for the session so that sterilization needs for radiology can be met. Students are then to expose their images and then evaluate their images before seeking faculty approval. Failure to evaluate their images prior to seeking faculty approval will result in a 5-point deduction. This is a necessary step for students to develop their critical thinking and self-evaluation skills. All retakes must be approved by a faculty member prior to exposure. Exposing retakes on a live client without prior faculty approval will result in an unsuccessful attempt for the series. Before dismissing the patient, a radiographic report needs to be complete regardless if the patient wants a copy of the radiographs at this time. A radiographic report is to be completed in addition to the take-home report. Both documents need to match in the radiology sections and include any radiographic findings from the dentist. Printing the images for the patient upon dismissal is not necessary unless the patient requests, but we do ask that it is ensured that the patient completes a radiograph records release so that we can email the images to a dental home. Students then have 2 weeks to complete their radiograph evaluation forms and turn them into faculty folders for grading. Any submissions after this 2-week deadline will not count towards clinic requirements. Faculty members will then grade and return the completed form to students. Radiographic exposure guidelines can be found in both program handbooks. Radiographs will be exposed on a patient only when appropriate justification for these images exist. The parameters of care published by the American Academy of Periodontology state that radiographs that are current, based on diagnostic needs of the patient, should be utilized for proper evaluation and interpretation of the status of the periodontium and dental implants. Radiographs of diagnostic quality are necessary for these purposes. Radiographic abnormalities should be noted. With this being said, the USI justification for exposing radiographs is based on caries and periodontal needs assessment, as well as any other conditions or requests by faculty dentist. This is not a one-size-fits-all approach, and students are expected to utilize these justification guidelines for their decision-making process. Radiograph contraindications are found in both handbooks. USI takes a conservative approach to radiographs on pregnant clients. Radiographs on pregnant clients will be taken only on an as-needed basis as determined by the staff dentist. Student requirements are also not a reason for a student to recommend radiographs to a patient. While students are allowed to share the requirements by letting a classmate take the radiographs on their patient instead when they are no longer needed for their requirements, students are not allowed to alter their recommendations based on their needs or lack thereof for clinic requirements. Students who express their requirements as the justification for the radiographic recommendations are to receive an NI in professionalism and radiograph assessment per faculty judgment. The frequency guidelines for exposure are outlined in the handbooks. USI follows the ADA guidelines for prescribing radiographs. This means that bite wings could be anywhere from every 6 to 36 months. Full mouth series and panoramics could be every 3 to 5 years. And periapicals are taken on an as-needed basis based on caries risk, periodontal status, or any other factors as deemed by the faculty dentist. Ultimately, the staff dentist makes the final decision. However, students are responsible for discussing with the dentist their own recommendations and rationales. The exposure of radiographs frequency guidelines may be based on camber risk. This is a form from the ADA, and there are separate forms based on age. These are separated by if a patient is under 6 years old or over 6 years old. The example on the slide is for a patient who is over 6 years old. I would like to note that question 3 pertains to patients who are 6 to 14 years old only. These sheets are available on the ring of laminated reference sheet in each operatory. Students may complete these forms prior to radiograph exposure to assist with determining the appropriate radiograph frequency. To use this form, wherever the highest check mark is what the caries risk is. So if there's only one check in the high risk column, then the patient is considered high risk. For the radiograph care plan and consent, we have created a care plan SmartDoc specifically for taking radiographs to eliminate any confusion of the required entries. Every entry on the radiograph care plan must be completed. Chief complaint needs to be filled out even if it is none. The dental codes that correlate to the different types of series have the appropriate terminology listed with them. To use this form, simply highlight which radiographs you are going to be taking at this time. So if you take bite wings and pano on the same patient at the same time, you use the same care plan. All radiograph care plans include terminology that allows for retakes as needed. This care plan is to be signed by the patient after approval of the image series by the faculty dentist before the radiographs are exposed on the client. The image retake guidelines are outlined in the handbooks. If there is a critical error present on the series, it should automatically result in a retake. This would include 2 millimeters plus of bone in all apices on periapicals should be present. Bite wings should have open contacts or overlap that does not exceed the DEJ, and panoramic films should be overall diagnostic. Non-critical errors are things that are considered that reduce the image quality without removing the diagnostic quality. So this could be a small cone cut that does not remove any necessary structures, slight overlap, or things of this nature. I would like to note that if the missing portion of the image is available elsewhere in the series, then it would count as a non-critical error and would not result in a retake. Again, students must evaluate their series for retakes and get faculty approval prior to exposing any retakes. Failure to evaluate prior to faculty approval will result in a 5-point deduction, and exposing any unapproved retakes will result in an unsuccessful attempt for the series. To further expand on what is considered a satisfactory bite wing image, we are looking for density, contrast, and definition that allows for interpretation. Bite wing images should contain the entire crown of each erupted tooth. On a bite wing, we are looking for open interproximal spaces and contacts, or overlap that does not exceed the DEJ. The occlusal plane should run through the center of the image, meaning that we can see maxillary and mandibular crowns equally. A premolar bite wing image should contain the distal of the canine. For a horizontal molar bite wing image, this should be centered over the second molar if the third molar is erupted, or if the third molar is not erupted, it should be allowing the minimal view of the edentulous area beyond the last erupted tooth in the mouth. For a vertical molar bite wing image, this should be centered over the contact between the first and second molar. This may mean that a second image may be necessary when the third molars are erupted. We are also looking for images that are properly exposed to avoid distortion, cone cuts, or artifacts. So any image that does not meet the above criteria may be considered unsatisfactory and will be evaluated as indicated for critical and non-critical errors. Satisfactory panoramic image will have density, contrast, and detail that are adequate for diagnostic purposes. It should also contain the crown, apex, and periapical bone of each tooth, as well as anatomic landmarks of the maxilla and mandible, and both condyles. Satisfactory panoramic images should be properly exposed to avoid technique errors like a too flat occlusal plane, exaggerated curve, or a cervical spine that is projected twice. Panoramic radiographs should also be free of artifacts and ghosting. The inferior border of the mandible must be visible in its entirety, and the anterior aspects of the image must display minimal overlapping. So again, any image that does not meet this criteria may be considered unsatisfactory and will be evaluated as indicated for critical and non-critical errors. For a satisfactory full mouth series, all of the bite wings outlines apply as well as periapical guidelines. So a satisfactory periapical image has density, contrast, and detail that are adequate for interpretation. The crown, apex, and periapical bone of each tooth should appear on the image. And there is a positioning for the average patient guide that's also available in the handbook to help you with each different periapical that's exposed in a full mouth series. A periapical image should avoid technique errors such as elongation, foreshortening, and cone cuts, as well as artifacts. We are looking for the tips of the cusp to be recorded with a minimum of the occlusal surface showing. Periapicals should have open interproximal spaces and contacts unless the teeth are out of line anatomically, with the exception of the maxillary canine image, because this may display slight overlapping on the distal of the canine. So if this area is open and visible on another image, this would not be an unsatisfactory image. So again, any periapical that does not meet this criteria may be considered unsatisfactory and will be evaluated as needed for non-critical and critical errors. I would like to say for molar periapicals, every third molar should be seen in its entirety unless it is severely horizontally impacted or located high in the maxilla. When part of the third molar is not on the image will be considered satisfactory only if the leading edge of the image was no further than the anterior of the distal of the second premolar, or as determined by the advising faculty member for the series. All radiographs must be evaluated within 2 weeks following the completion of the image. This includes panoramic, bite wing, and full mouth series. Students must turn in their completed form to the faculty members folder within this time period, or it will not count towards their clinic requirements. Faculty members are expected to evaluate Smart Docs and out-of-notes radiograph portions as part of the documentation check at the completion of the clinic session that the images were exposed. When completing the evaluation form for the radiographs, we request that these sections are double-checked for completion and evaluated as part of the documentation grade for the radiographic series. So this means going into Smart Docs and looking at the radiographic care plan and ensuring that it was created and signed, looking that the radiographs are noted in the take-home report, and that the radiograph report was completed. And then in auto notes, we ask that the radiographs are noted under treatment in its entirety and accurately. So to just summarize, reasons that a bite wing may not be considered satisfactory is if there's incorrect horizontal angulation or overlap, if there's a cone cut, if the images are not diagnostic, if the distal of the canine is not present on the premolar images, if the distal of the last molar in the mouth is not present, having poor overall sensor position, which would likely result in too many retakes, any processing or exposure errors, patient movement that's not corrected, or having a visible sensor cord. Here is the bite wing evaluation form used in the clinic. So this form is filled out as an example of how this form was intended to be used upon its creation. So we would like for the molar images to be in the outside boxes. We would like for the premolar images to be in the second boxes, and that would leave these 3 middle boxes for any anterior images or additional images. Here's an example of a 4 vertical bite wing series that was taken in the clinic. And so I'm going to walk through how an evaluation form would be filled out for this specific set of images. For the radiology evaluation form, students will document in blue ink and use the top box, and faculty members will document in red ink using the bottom box. The students must evaluate for dentition and technique type before grabbing faculty, and then this total number of images must be filled out after all the images are taken. If it is left blank, then this will be a -1 for documentation. So then the student must evaluate for all technique errors that result in critical errors or retakes using the numbers 1 through 8 from the list below, as well as correct mounting before grabbing the faculty member immediately after exposure. Failure to do so will result in a 5-point deduction. So students will document with an R to indicate a retake with the number associated with or an arrow pointing forwards or backwards to indicate sensor placement issues. So this written communication helps to avoid pointing out any errors or flaws in the student's treatment in front of the patients. A faculty member could walk into the unit and simply say, yes, I agree with this assessment. So this student, I have circled it here, they did not correctly mark that they needed a retake for this molar image. So that would be a -1 for the lack of documentation or interpretation, as well as a -1 for the retake itself. So students not marking any of the technique errors when they are present will be marked for a missed interpretation. If a student incorrectly assesses their need for retakes, it is marked as a miss for interpretation as well. So if they incorrectly mark that they do need a retake when they don't, that's only a -1 for interpretation. In this instance, the student gets a -2 because they require a retake, but they did not document it or interpret that correctly. In general, on a bite wing series, we take a 4 vertical bite wing format unless this is specifically approved by a dentist or faculty member otherwise. And so regardless of the type of bite wing series, 2 retakes are permitted. So 3 or more retakes result in an unsuccessful attempt, and then the student must remediate on a dexter. On a live client, we are simply aiming for diagnostic films and not perfection in order to limit patient radiation exposure. So we should be evaluating the series to see if we can see the missing anatomy anywhere else on the images. With that being said, we have additional images. These are any images that are taken beyond the 4 bite wing series due to patient anatomy or other concerns. These images do not count against the student as retakes, but they must be evaluated for technique errors, bone levels, caries, calculus, etc. So with that being said, these additional images can be taken in the format that the faculty member approves, meaning faculty members are allowed to recommend that a student takes these additional images in the horizontal format in order to capture all necessary anatomy. Again, students must evaluate for technique, landmarks, and pathology within 2 weeks of exposing the series, or they will not receive credit towards their clinic requirements. I would like to note that any infection control issues such as PPE, cross-contamination, or issues with flipping the dirty and clean magnets, any safety errors, so not using the lead apron or staying in the room during exposure, or exposing an unapproved retake will result in an automatic unsuccessful attempt. And then this student was correct in all of their bone level interpretation changes. And I would like to note, so there was no recurrent decay or anything like that, so the student didn't have an opportunity to make this error. But if a student was to correctly circle yes on any of these boxes, but did not fill out the tooth number and surface, that would result in a -1 in interpretation and documentation. There are a front and back to all of our evaluation forms. So on this area, this faculty comments and deductions, we are expected to explain the deductions to the students, including how to improve them for next time. I would like you to view this as an opportunity to provide meaningful feedback to eliminate future errors for the students. For this documentation area, this is where you're expected to go into the EagleSoft Smart Docs and check that the radiograph care plan was created and signed, that the radiographs are noted in the patient takeover report, and that the radiograph report was completed. We also need to check that the auto notes for the patient have the radiographs noted under treatment in their entirety, including the series taken with any retakes and reviewed by Dr. Blank. For bite wing grading, these are graded out of 100. And so every line needs to have something on it, even if it's -0 for our quality assurance tracking purposes. So every single line item over here needs to have something on it, even if it's 0, to ensure that it was not skipped or forgotten. So I went through here, I included -1 because they needed a retake on that molar to get it more distal. And then they also got a -1 because they did not recognize a need for that retake, like I talked about on the last slide. So then I tallied it up over here. So the retake was -1 and then interpretation was -1. So overall, that student received a -2, which was a 98%. So right here we have the percentage that's needed. So depending on the semester that the student is in, and the program depends on what percentage they must meet to be successful for that attempt. So 98 meets all of these requirements, so that percentage was met. The student required 2 or fewer retakes, so check that. The student followed all of the infection control and safety guidelines, so I checked that off. And then I initialed this after I enter this requirement into Trajexis. The faculty initials is important so that the student knows who to ask if they have any questions regarding the series. And then down here where it says it did not meet competency and remediation is required is when this number right here does not match this number right here for the student's semester in the program. For the panoramic evaluation form, this is also graded out of 100 points. 1 point will be deducted for each error involving processing, technique, or patient positioning. 1 point is deducted for each error noted on the interpretation section of the evaluation form. Students are required to attain competency at the level appropriate that they are for the semester in the program. These are listed on each evaluation form. If the competency is not met, a satisfactory image must be obtained on the Dexter before exposing additional radiographs on live clients. Again, this radiograph form must be completed to the advising faculty member for evaluation within 2 weeks of the exposure, or the series will not count towards the student's radiograph requirements for clinic. Here is the example panoramic that we will use to walk through the grade sheet on the next slides. Again, students will write in blue and faculty members will write in red. So the student evaluation must be completed prior to seeking faculty evaluation. So this is the left-hand column. Each box needs to have a check yes or an X no in each box. Do not leave any boxes blank, and each box must be completed. So if a student earns an X or a no, the student must write the corrective action in the box on the right side. This shows the faculty member that the students are recognizing their errors and thinking through how to fix them. So on this particular image, the patient was very slightly off center, but this image was still overall diagnostic, so I considered it okay. However, the patient's tongue was not fully against the palate, so this allowed for some excessive radiolucency during exposure. So as you can see here, the student gave a yes that they did have that, not recognizing that they had excessive radiolucency in the palatal area from lack of proper tongue placement. So since the student had a lack of proper tongue placement, they earned a -1 in the criteria deductions. And since they also did not recognize it, they earned a -1 in the interpretation. I will say for panoramics, if I hear a student instruct the patient to place their tongue to the roof of their mouth and keep it there throughout exposure, I likely would not remove a point for criteria deductions as long as the student told me that they realized that the patient did not comply. Now, if I don't hear it and the student doesn't recognize it, they're definitely getting the -1 for the criteria and the interpretation. So here, since the student didn't recognize that they had this issue, the faculty member was the one who had the corrective action right here. So from this criteria deduction, the student earned a -1, so the faculty member filled that out. We'll leave this interpretation deductions blank until we fill out the back of the form. Here is the back side of the form. Again, the 2-week evaluation rule applies. So this portion of the form is geared towards pathology assessment. And as a reminder, the staff dentist must assess every single panoramic taken in the clinic as part of the radiograph review. So the student correctly assessed the adult dentition, the fact that there was no radiolucent bilateral symmetry or radiopaque bilateral asymmetry. There was no mixed asymmetries. For evidence of prior dental treatment, I need the teeth numbers, the surfaces, and the material. So this has 6 through 11 and 20 through 27 lingual bars. That's acceptable. Number 29 and surface DO, and number 30 with the surface MO composite. So the fact that the student had the tooth number, surface, and material was how they earned full points for this evidence of prior dental treatment. So I want to know if it's composite, amalgam, stainless steel, gold, porcelain, root canal, etc. For missing teeth, they said yes and gave me the tooth numbers. So for any of these portions, if the student says yes but doesn't explain the tooth numbers or surfaces, then they are missing those points per tooth for interpretation. So missing teeth was correct, impacted teeth was correct, and then all of these were correct as well. The bottom back portion of the panoramic evaluation form is geared towards anatomy assessment. So this specific image was chosen because these landmarks are the most likely to show up on boards. And so students must evaluate for all applicable landmarks on all images. So for example, assume the student did not circle number 15 as present in the pterygoid plates. Well, looking back on that panoramic, the pterygoid plates are present on this image, so I would mark the mistaken anatomy portion here. Students are allowed to circle down here or on the actual image as long as they are consistent with it and you are able to grade it. So flipping this form back over to complete the interpretation part of it, this is what it should look like. So I went back and I included that interpretation deduction from the back. Then I tallied it up and the student earned a 44, which is applicable for all semesters of the program. So the student earned a competency. And then I checked off that I entered it into Trajexis and I entered my initials in case the student has any questions. Moving on to the full mouth series evaluation, these are also graded out of 100 points. So 1 point is deducted for each image displaying a non-critical error. So for example, 1 point would be deducted on a mandibular premolar periapical that does not display the distal of the second premolar as long as that area can be seen on the mandibular molar image. So again, it's considered non-critical if the area of concern is being able to be seen on another image in the series. 1 point will be deducted for each error or omission of the radiograph interpretation for each error on the progress notes. 1 point will be deducted for each retake unless the rationale for not doing so is clearly stated on the evaluation form by the clinical faculty at the time of the retake. 5 points are deducted if the student does not evaluate the technique error and associated point deduction before the faculty member comes back to assess the radiographs. And these images will not count towards requirements if the appropriate precautionary measures are not followed. So any failure to use the lead apron, thyroid collar, or any infection control concerns, things like that. Again, all radiographs must be evaluated within 2 weeks following the completion of the images. So then these radiograph forms need to be submitted to the advising faculty member who assisted the student in taking the series. And then the patient's electronic file must contain the student completed radiograph report. And then any images that do not meet competency must be retaken on a Dexter until the competency is attained. For the full mouth series evaluation form, a student will earn a -1 if the error does not directly affect diagnosis. So this means that each tooth is visible in its entirety on at least one image. If the image in question has an error, but the tooth or teeth can be seen on another image, the deduction is 1 point. 1 point is deducted for each retake needed, and 1 point is deducted for each incorrect mounting of an image as well. So reasons for a -1 deduction on a full mouth series could include a cone cut, foreshortening or elongation, artifacts, slight overlap that does not exceed the DEJ, a close contact that is visible on another image, sensor placement that is corrected elsewhere in the series, or having a visible sensor cord. So again, if you can see any of these errors fixed on another image on the series, it is a non-critical error, so they earn a -1, and there is no retake needed. Critical errors indicate that you cannot see the tooth or the space where the tooth should be in its entirety. This means the image must include 2 millimeters of bone around the apex and no overlap from the CEJ to CEJ. If the image in question has an error, but the tooth or teeth can be seen on another image, the deduction is 1 point and is not considered critical. So critical errors could be sensor position not anterior or posterior enough that is not corrected elsewhere in the series, cone cut that is not corrected elsewhere in the series, excessive foreshortening or elongation, artifacts, overlap into the dentin where you cannot see CEJ to CEJ on the periapicals, crowns or apices cut off that you cannot see elsewhere in the series, an exposure error or patient movement that's not corrected, and instrument assembly, meaning the student put their XCB together incorrectly, which resulted in a cone cut or incorrect placement that was not corrected elsewhere in the series. We will use this example full mouth series from the clinic to walk through the grade sheet. So before we begin, I would like to say that we are not necessarily looking for the contacts to be open on the maxillary canine PA because per anatomy, sometimes it is just not possible. So I would like to note that students must recognize this error, but faculty do not need to deduct for this error on the technique portion. If the student does not identify the error, then that is an interpretation deduction. Again, students will document in blue ink in the top box, and faculty members will document in red ink in the bottom box. Students must evaluate for technique and retakes using the numbers 1 through 8 from the list below, as well as any mounting errors prior to faculty evaluation, immediately after exposure, or the student will earn a 5-point deduction. Students will document with an R to indicate a retake with the number associated with the error that resulted in a retake, or an arrow pointing forwards, backwards, or apically for sensor placement issues. On a full mouse series, 4 retakes are permitted. 5 or more retakes will result in an unsuccessful attempt, meaning the student must remediate on a dexter. Again, we are simply aiming for diagnostic films, not perfection, in the interest of limiting patient radiation exposure. We do need to assess all other images in the series to see if the anatomy of interest is visible elsewhere on the series. If we can see the anatomy of interest elsewhere on the series, no retake is required, meaning it is not a critical error. If it's a critical error, it means we will not be able to see it elsewhere on the series and it will require a retake. This particular image series did not require any retakes, so the student correctly documented this in the boxes. However, the student failed to document overlap on the right premolar bite wing, so that would be a -1 for interpretation, as well as a -1 for technique. The student correctly documented all of their anatomy, which is the numbers, or the letters, excuse me, associated with the bottom of the form here. For the bone level changes, if a student circles yes, they must fill out this table below. The student can leave it blank if it's not applicable, but if the student circles yes up here, somewhere on this table, they must also have a response. For vertical bone loss, we are only expecting the student to give us the tooth surface and the tooth number. So this student correctly filled out all bone level changes for the series. For caries, we are expecting the tooth number and surface again. So if the student circles yes, they must have a response for tooth number and surface. This student correctly noted the frank caries on number K distal. So with the primary teeth, this way that this is documented is correct. As long as the faculty member understands what the student is talking about is acceptable. Down here, very similarly to the panoramic, anything that says yes must have the location or the tooth number and surface. I will say with this, the patient does have a retained number K. And so often what happens with retained primary teeth is that the students will forget to also document the missing permanent tooth down here. However, this student correctly documented that. So there was no deductions up here for the interpretation. So using the back, the student had -4 for 4 different areas of non-critical overlap on the bite wings, -1 for non-critical overlap on the right premolar bite wing that was not documented, and then -1 for a non-critical foreshortening on the mandibular central PA. So this first box and this third box, the student interpreted that correctly, so they only received the technique deduction, not the interpretation deduction. So going over here, tallying everything up, again, every single line must have something on it, even if it's -0 for quality assurance purposes. We tally up our deductions here. So -6 is equal to a 94% because this is graded out of 100. So the student earned a 94 in the series, which is passing for every single different semester that a student might be in our program. So a check mark percentage was met for competency. The student required 4 or fewer retakes. The student followed all infection control and safety guidelines. And then I only check this box after I enter this requirement summary into Trajexis. Again, I initialed so that the student knows who to ask if they have any questions. And you only mark down here if the student was not competent. So this number right here did not meet the number for the semester that they are in, and the student requires remediation. And then another note, any faculty comments should be very specific so that the student is able to learn from each series that they expose in the clinic. The radiograph report is utilized as a cover letter to go with patient radiographs when their radiographs are emailed or printed for their dental home. This report needs to be completed every single time a patient receives x-rays in our clinic, regardless if the patient wants a copies of their x-rays at that time. There have been instances when patients change their mind and require their radiographs at a later date, so we need to always complete this form in the case of those instances. On this form, all portions need to be complete and saved to the patient's smart docs. Down here for comments, this includes any findings from the staff dentist on the radiographs. If patients wish to have their radiographs emailed or printed for pickup at a later date, this form, the release of records form, must be completed and saved in the patient's file. This does not have to be completed to print the records and hand them to the patient at their appointment in the clinic, however. The radiograph release forms expire 1 year after the patient has signed it. If the patient wishes for the radiographs to be sent to a different recipient than what is listed on the form, they will need to fill out a new radiograph release form for the new recipient. For the auto notes portion of radiograph treatment, the student's first name and last name in their entirety should be filled out. We have had multiple instances where students share a first initial and last name. So we will have a blank X-ray series. So this will have a 4 vertical bite wing, 4 horizontal bite wing, 18 full mouth series, 1 panoramic, anything of that nature in this little blank here. X-ray series with what number of retakes needed. So this prompts the student to enter 0, 1, 2, 3, 4, or etc. Then we added X-rays reviewed by Dr. Blank. So the student needs to put in the doctor who reviewed their radiographs that day in this section. Findings from staff dentists include any radiographic findings, and then anytime radiographs are exposed in the clinic, there always needs to be a referral to general dentist for exam, or any referral for treatment that the staff dentist decides that day based on radiographic findings. And then quickly for trajectosis, to fill this out, the subject is the student, and then the site is the USI Dental Clinic. So the client initials must always be filled out and accurate. And then you only click yes for the type of series it is, and you will submit a new form for each different type of series. So if you complete a bite wing and panoramic series on the same client, you will submit a different trajectosis form twice. So please be aware that the Dexter requirements are separated from the live client requirements by the Dexter indication right down here. Then you will click the bubble that correlates to the specific number of retakes for each specific different reason of a retake would be taken. I would like to note that more posterior is not the same as more anterior to get the distal of the canine. And then number 8 on the paper form or other on this form needs to have an explanation using this comment bubble every single time. The bite wings and the full mouth series are separated for this section. And then any retakes for a pano, periapical, or occlusal needs to have a specific comment section right down here. So then if the student is successful, you will circle successful and then approved and hit submit. If the student was not successful on their series, you will enter unsuccessful button here, and then you will hit the not approved button down here. So if you hit not approved and then you hit submit, it will still submit this entire form to the clinic coordinator. The only time it does not submit it is if you hit complete later and then submit. So if a student is unsuccessful, click the unsuccessful bubble here, and then the not approved bubble down here to further flag this series for the clinic coordinator. Thank you for watching this presentation. I hope it was helpful for you in how to correctly evaluate our students' performance regarding radiology in the USI Dental Clinic. My contact information is on the slide if you need to reach out with any questions, comments, or concerns regarding anything related to radiology in the clinic. Thank you.